Good afternoon. I'm Mark Fox, the Deputy Health Officer for the St. Joseph County Department of Health. Thanks for joining us for this update on COVID-19 in St. Joseph County. I'll be providing an update on current status of the coronavirus in our county, including a deeper dive into the demographics of both the confirmed cases and individuals requiring hospitalization as a result of COVID-19. We have some slides to share, and so I'll turn to those now. As of last night at midnight, there were 154 confirmed cases of COVID-19 among residents of St. Joseph County. Additionally, I'm sad to report today that we have the second death of a St. Joseph County resident as of late last evening. So an elderly woman who had been tested back on March 18th in an era when the test results took 10 days to come back. So her test was confirmed positive on March 28th, died following a prolonged hospitalization. So, of course, the most observant among you will notice discrepancies between what we report at the county level and what gets reported to the Indiana State Department of Health. And so I want to speak to that very briefly. And first is that the data regarding infections and deaths and things come in from multiple sources and get updated at different times. So typically when an ordering provider orders the lab, they get the test result back first. They will often call the health department during the course of the business day, and those cases get assigned to our nurses as they come in. In addition, overnight we get a feed from the lab that reports test results ordered by any provider in St. Joseph County. Those providers may be testing people from other counties and other states. The State Department of Health also gets a feed from the labs, including labs involving St. Joseph County residents who likewise may have been tested in other jurisdictions. So given that these results come in from various sources and cases get opened in real time, there will necessarily always be some discrepancies on a day-to-day basis between what we report and what the State Department of Health reports. Those are usually a pretty modest handful of differences in the number of cases. We've been asked a number of questions about discrepancies in the tests ordered and what's reported by the State Department of Health. Again, the three big health systems in the county have tested in excess of 2,800 people. Again, not all of those are St. Joseph County residents, but we're well into the 2,000s in terms of the numbers of tests ordered by providers in St. Joseph County. So I can't speak to the cause of that discrepancy. It likely has to do with the source of those data feeds, but I want people to know that we have tested well into the 2,000s of St. Joseph County residents. Our days to test results continues to improve, so we're currently at 5.2 days taking all positive tests into account. Among confirmed cases, 54.5% of the positives in St. Joseph County have been in women, 45.5% among men. This slide depicts the age distribution beginning at the bottom with the younger age cohort, so those under age 19 representing 9%. And you'll see each age strata as we go. Most striking is that in St. Joseph County, 56.5% of cases have been in individuals under the age of 50. Sorry. This slide is the racial and ethnic data that we have on confirmed cases in St. Joseph County. So two-thirds have been in individuals who are white, not of Hispanic origin, 13% among African Americans, about 10.5% among those identified as Hispanic, and then smaller proportions representing Asians, and then 5.8% whose race or ethnicity is not identified. For the first time, presenting some data on hospitalization. So the flip side of what we've seen with confirmed cases, 63% of patients requiring hospitalization have been male in St. Joseph County. The total number of individuals requiring hospitalization is only 19. 37% of those requiring hospitalization have been female. So these numbers, the total count of 19, also includes the 2 individuals who have died in St. Joseph County. Or I should say St. Joseph County residents who have died as a result of COVID-19. This is the age distribution for those requiring hospitalization. So contrary to what we see in terms of the distribution of confirmed cases, overwhelmingly it's individuals age 60 and older that have required hospitalization. And then this is the racial and ethnic distribution of those requiring hospitalization. So 42% of those requiring hospitalization are white, not of Hispanic origin. About a quarter, just over a quarter, are African American. And again, just about a quarter or slightly over are Hispanic. This slide depicts the blue line, the blue bar represents new cases added each day based on when the result is received. The orange bar reflects the cumulative number of cases in St. Joseph County over this time. So you'll see 10 days ago we were on a pretty steep trajectory here, and it has leveled off somewhat over the last 4 or 5 days. Again, this speaks to both, a week ago when we talked, our lab results were still taking about a week to return. Our test results have come back more quickly, so you see the number of results coming back just in the last 5 or 6 days. But this also reflects the impact of both the city and the county emergency declaration and travel advisory and the governor's stay-at-home directive. So we're finally realizing the benefit of those mitigation strategies. This slide is kind of a busy slide. It's the number of test results coming back on any given day. These are the tests by the date that the test was ordered, and then the average days until the return of those tests. So you'll see, again, a week to 2 weeks ago, tests were taking a week or longer to return. Over the last 5 to 6 days, we've consistently been in a 1 to 2 day turnaround. So that has dramatically improved our ability to make real-time decisions. And this is probably the most encouraging slide of all. So the data for St. Joseph County is represented here in the blue line. It's superimposed on another graph representing national data. But you see the trajectory for Indiana as a whole is here. And here in St. Joseph County, we've seen significant flattening of the curve. So again, it speaks to the impact of the mitigation strategies that have been pursued. I think the important message is that at this point, while that data is encouraging, we can't take our foot off the gas either. So we recognize the impact that stay-at-home order and pleas for maintaining physical distance have on people in their daily lives. It's really important that we maintain those measures with similar intensity. I encourage people to think about, your household as one unit, and any foray out into the community represents an exposure to you that you bring back into your household and an exposure of your household into the community. So really limiting any public adventures. A little feedback here. So trying to undertake errands in one trip, even in one stop, if at all possible, is important. Limiting the number of people that are exposed out in public is important. Those measures, again, are important not only to protect yourself and your household members, but also to decrease the burden on our healthcare workers. Last night there was a great parade of sirens by the hospitals. One of my colleagues thought that some mass casualty has happened and was really frightened and called me to find out what was going on. That was a great show of support for healthcare workers. Healthcare workers often get shortened to doctors and nurses, and I think it's also important that people recognize the host of other individuals in the healthcare setting that are providing care. So respiratory therapists and x-ray technicians come in contact with almost every patient who's hospitalized or under investigation for COVID-19. The shorthand often leaves those individuals out, but they have significant exposure, as well as all the healthcare providers out in the community working in offices and conducting the bulk of the testing in St. Joseph County, who likely didn't get to witness the parade last night, but I want to make sure that people are mindful of their efforts and their contribution to our response to COVID-19, as well as all the people, again, staffing grocery stores and drugstores and other places that we rely on for our essential activities. The last thing I would want to stress is that this is a time for people of many faith traditions to engage in religious observance of their holy days. Those are important in the context of their faith tradition, and it's also an important time to be creative in how we do that in a virtual setting, and to not gather for those celebrations because of the need to protect the most vulnerable, which includes many in our community who are working on the front line, whether it's in the grocery store or in the hospital and other healthcare settings. So the mitigation strategies are having an impact, but it's critical that we maintain our focus and keep our foot on the gas in preventing the spread of coronavirus. I will turn it over to Mayor Mueller.
Thank you, Dr. Fox, for that update, and thank you to the Venue Parks and Arts team here for establishing a way to have this press conference in a responsible manner. We're encouraged that our sacrifices are paying off and helping to slow the spread of the virus in our community. The quicker turnaround time for tests is also good news, because that means we have a better idea where we are closer to real time. And on behalf of the community, I want to thank the health department for all the work they've been doing to prepare us for the peak of this pandemic locally. Last night, as Dr. Fox mentioned, you may have seen or heard that our first responders stopped by Memorial Hospital and other facilities across the community to honor our healthcare workers. I'm proud of our police officers, firefighters, doctors, nurses, technicians, and therapists on the front line keeping us all safe. They all deserve the community's recognition for their contributions and sacrifices, and we must do everything as a community that we can do to support them. That means we need everyone to take responsibility and follow the distancing measures in place. Over the weekend, SBPD broke up a party where people were congregating and socializing irresponsibly. The governor's stay-at-home order is not a suggestion and should not be taken lightly. If you plan on hosting a party or pursuing other reckless behavior, cancel those plans now, or we will cancel them for you. I want to thank each and every one of you who have taken the distancing measures seriously. While it's important to acknowledge signs of success, we can't become complacent about the risk that this virus still poses to our community. We're still a few weeks away from the peak. We don't know exactly when it'll hit, and we need to do even better to slow the spread and enable us to begin reopening at least parts of our city. That brings me to a difficult topic to discuss, the religious holidays celebrated this month. In normal times, Passover, Easter, and Ramadan offer great opportunities for meals and services with extended family and friends. But this year, we must find creative ways to celebrate these holy days. Physical gatherings of any kind put our entire community at risk and could roll back the progress that we've made on mitigating the spread of the virus. I commend the many faith leaders who found a way to fulfill the important spiritual needs of our community remotely. Those who are considering holding in-person services need to reconsider and find a safe alternative. I know these sacrifices are real, but we need to double down on our mitigation efforts. I continue to be impressed and proud of the generosity of our community. This week, the United Way's COVID-19 Response Fund exceeded $1 million in donations to help provide food, shelter, and health care to those most in need. Earlier this week, Haircrafters gave 1,000 masks to the city for use by our employees. The Knights of Columbus, in partnership with EBS, donated lunch to all 11 fire stations for all shifts. Residents have dropped off gloves, masks, and homemade face coverings for our firefighters. And a number of local restaurants have dropped off food for our police officers and firefighters, even as they face difficult times themselves. I'm disappointed to share this news about one of my favorite weeks of the year. Best Week Ever, which was scheduled for the first week in June, will be postponed. This was a tough decision, but we'll likely still be managing the spread of COVID-19, at least in some way, in early June. I look forward to the day when we can all gather once again and enjoy the best week ever together. I said it last week, and I'll say it again. We're still climbing the hill, and we cannot count on the cavalry to arrive and save us. Other communities are facing the same problems we are, so we need to find the way through this together as a community. If you do your part, stay home, wash your hands, and stay away from others, you'll help save lives. Don't be the person who infects others. Don't be that person. We're all in this together, and we'll get through this challenge together. Please keep doing your part. Stay at home, maintain physical distance with others, and continue the generosity in helping those in need. Thank you.
Hi, I'm Jackie Walorski, Indiana's 2nd District at the federal level in the U.S. House. I want to add my thanks as well to the United Task Force that has just been an incredible, tremendous asset in our community. How professional and efficient they've been has been unbelievable. All of us in the Indiana 2nd District, but specifically right here in St. Joe County, can be thankful and know that the professionals that we have looking at this and keeping our community safe and healthy are the best of the best. You know, I sit in Congress every day, minus the last 2.5 weeks, listening to the way things are going around the country, and I can tell you there's no community like our community. Michiana is a resilient community. We know how to celebrate together, and we know how to care for each other. And I want to thank everybody, every person in our Michiana area for heeding the word of not only locally here of the United Task Force and the city leaders and the county leaders, but also the governor. You know, it is exciting news that we're making progress, but I just want to add my thoughts that this really is a time to double down. We're going to win this. This is an invisible war. We're going to win it, and we're going to be stronger on the other side of it. But I just wanted to give a quick update on what's happening to the business sector. You know, we've heard a lot about, you know, what we're doing to get on top of this medical invisible virus, and we're doing great strides. And since I was here last, Congress has passed the CARES Act. We actually passed this act, and we are looking at right now the unveiling and the rolling out of 2 important programs. One that completely identifies every individual in this country as single or married. So the checks that you heard about coming in to help individual families are $1,200 per adult, $500 per child for single. If you're married, it is $2,400 for a married couple filing jointly, and $500 per child. On the individual side, that is a cap of as long as you're making under $75,000 and married under $150,000. You know, we just wanted to get money into the hands of families and into individuals to be able to purchase the things that you're going to need over the next couple of weeks as we continue to gain momentum on victory over this war. The other issue that is in there is temporary expansion of unemployment benefits. So on top of unemployment in Indiana, there's an additional federal kick-in of $600 per week per person. And so when you are calling the unemployment office, understand they're dealing with a 2,500% increase in the number of unemployment claims. But that money is there for you. It'll be retroactive to the date at the end of March, and we just want you to know the help is on the way. The other part that I think is really important, when we passed the CARES Act, that was a $2 trillion bill. You've heard a lot about it in the news, and you may wonder, what was the bulk of that money? The bulk of that money is for a program called the Paycheck Protection Program for small businesses all through our community and all through the Indiana 2nd District. If you're a small business and you primarily need to be able to cover payroll, this is the program for you to apply for. I would urge everybody in our listening area, if you are a small business, if you're mom and pop, if you're 1 or 2 employees, up to hundreds of employees, please go to your local lender, go to your bank. You don't have to go to the SBA website. Call your local lender and get involved in applying for this program. 75 to 100% of this loan is forgivable and will end up being a grant, just as a way to hold a safety net around small business in our community. I would encourage you to check out this program. If you need help, if you have questions, if you feel like you need somebody to advocate for you, call our local office. It's 574-204-2645. Our staffs are working, our offices are open, we're all working in individual silos at our houses like everybody else is, but we are there to take your call and to help you get the security that you need to get through this. And I want to just say that, whether you have calls about, where's my check coming into my direct deposit, I'm a Medicare, fixed income, I'm a veteran. You know what? There are places for everybody that has a Social Security number to be receiving money to hold our individuals and families together. So I just want to reiterate, help's on the way. This is a really important weekend. This is Easter. This is Resurrection Weekend. This is a weekend to celebrate life. And you know what? Together in this community, we're going to be able to get over this together and be far more stronger and resilient than we even are today. I can't thank our local and state leaders enough for how they've worked together to bring help to everybody in our district.
Now we're going to go to Andy Castelny. Andy, if you can unmute yourself, you should be coming through the speakers here.
Yep. Well, thank you. The disaster declaration by Governor Holcomb has allowed the National Guard to be deployed here in St. Joseph County. We're very thankful for this increased effect. We've also instructed the Emergency Management Agency to help coordinate all the COVID-19 related expenses for the smaller municipalities, townships, and appropriate entities to make sure that we're collecting and coordinating all the expenses related to COVID-19 so we can submit that for reimbursement in the future. As has been mentioned, unemployment numbers continue to rise in St. Joseph County, as there have been over 11,500 filings in the last 2 weeks. We anticipate this only getting worse, so people please be mindful of that. But these times also bring out the best in people, whether it's the young man in Mishawaka who is 3D printing masks, or the Notre Dame esteemed students who started helping hearts through hand, that provide assistance to those who are homebound, running errands and getting food and those things. It's great to see our community coming together in times like this. I also want to applaud our local efforts. I think the early and swift action we took has been very impactful. I also want to applaud the great work done by the health department, who were on top of this from the very beginning, making sure that we were doing things the way they needed to be done. Sometimes not the easy thing, but the things that needed to happen. That said, our work is not done. As Brian Kelly said yesterday, we are barely to halftime. It's still important that we keep our focus, especially as we approach one of the most important religious holidays and weekends of the year for many of us. As has been said, it's very difficult for us not to be with our friends and loved ones, not to mention our faith community. But it's important that we maintain physical distance and take advantage of the numerous remote worship options that are available. Finally, I want to give thanks to all those who put themselves in danger every day to help give us some semblance of normalcy. Whether it's our first responders, doctors, grocery store clerks, who are constantly putting themselves in harm's way to make sure that we can continue to live our lives the way they need to be lived. I want to especially thank and pray for our nurses, in particular my daughter Maddie, who is starting a new rotation in Indy this week. May God continue to keep you all safe and blessed. Thank you.
Great, thank you, Commissioner Castellani, and thank you each of you for sharing some great remarks. So it was a week ago today that I joined this effort to really help coordinate efforts with the City of South Bend and St. Joseph County. So the past week has given me a chance to have a front row seat at the effort that's going on here, and to really start to roll up our sleeves and begin to respond to this crisis. And so we have devoted our full attention to this matter, and as was reiterated several times here, you, the folks that are viewing this, the people in our community, should have a lot of confidence in the team that's working hard to make sure our community responds well to this. There's a great deal of planning that's happening in the background, as you have seen the spike start to happen in other parts of the country. You've seen some of the contingency planning that needs to happen, and so our public safety and our healthcare workers, the health department, everybody's working really hard to make sure that if we need an overflow opportunity, we have an overflow opportunity. If we need a isolation or quarantine facility, we have that kind of facility. Mark talked a lot about testing today. We want to make sure that the testing is equally accessible all across the entire community, and our healthcare systems are committed to that. And whether you're north, south, east, or west in St. Joe County, they're working to make sure you have those opportunities. The suggestion, remember, is still to go to your healthcare provider and explain your symptoms, and we'll get you to that test where you need it. But I think you'll see in the next few weeks really working to roll that out. It's important to note, Mark shared St. Joseph County data, but all of us in the region are in this together, so our hope is that our neighbors are doing some of the same things, and so there's a lot of conversation and coordination happening across a regional basis. Last week, there were some questions about Mishawaka, and yesterday I had a chance to meet with their team and talk about this. It's a well-coordinated effort across the region, and so generally I think the other thing that's happened over the last couple of weeks the last week, I guess, is as companies are stepping forward, talking about producing PPE, as people are asking how they're getting involved, we're really trying to coordinate that effort too, so that we're not duplicating efforts and we get need to where those greatest needs are. So I just am grateful for the folks that, as our whole group said here, that are working really hard to address this. And I think there's a lot of unknown over the next few weeks. And as the governor tried to reiterate today, staying home and social distancing is the most important thing that we can continue to do, and especially want you to resist that temptation this week of doing that. So with that, I think we'll wrap up really formal remarks, and we'd love to take some questions.
Okay, so can everyone hear me all right? You could just nod. Perfect. We're going to start. I'm going to run through the list, and I'll call on everyone individually, and you can unmute yourself. Please start your question by letting us know who the question is directed to, and then go ahead and ask it, just so we can get the camera on that person for the live feed. So we'll begin with Anna Caroline Caruso from WVPE. Anna Caroline, good to talk to you.
Hey, Caleb. Yeah, I'm actually good. I don't have any questions.
Okay, thanks. We will move to Bernardo Malone from SBS TV. Bernardo, thanks for tuning in.
Hey, Caleb. I have no questions at this moment.
All right. Thanks, Bernardo. We'll next go to Brenda Coopson from ABC 57.
Hi, I don't have anything at this time. Thank you.
Okay. Thank you, Brenda. We'll now go to Christian Scheckler with the South Bend Tribune.
Hi, Caleb. Thank you. My first question is, can I use the questions that were passed on by the other folks so far?
I'm sorry, what was that?
My first question was, can I use the 6 questions that
Oh,
were passed on by the other folks so far?
Sure, if you want to, whatever questions you have, Christian, go ahead.
I'm just kidding. My questions, I think, are both going to be directed towards Dr. Fox. The first question is about the race and ethnicity demographics regarding the COVID cases in the county. It looks like, based on the numbers that you've presented today, St. Joe County has not seen quite the disproportionate number of COVID infections among the Black community in particular and the Hispanic community here that we've seen reported about in other places. But we do have, it looks like, a disproportionate percentage of those populations who have been hospitalized. So in terms of the infection rate, do you have any explanation for why we may not be seeing the disproportionate infections? And does that possibly have anything to do with disparities in testing? And in terms of hospitalizations, similar question, do you have any information about, why those populations may be being hospitalized at a disproportionate rate?
Yeah, those are both really important questions. So let me speak first to the hospitalization data. These numbers are really small. I believe it was 5 each in the African American community and Hispanic community who have been hospitalized to this point. So it's hard to draw really firm conclusions about what that means. Certainly they're overrepresented with respect to their distribution in the population as a whole, but 1 or 2 cases, one way or the other, those proportions in terms of the hospitalization, because the numbers are so small, could swing fairly dramatically. To your other point about testing, one of my concerns is that actually there may be an underlying disparity with regard to access to testing, and that's an initiative that we're trying to dramatically expand access to testing, especially on the west side of the county. The east side of the county, because of the distribution of healthcare providers, has been very well positioned. I'm concerned about access on the west side. So working within the Unified Command and with the health system partners, we're hoping to have 1 or 2 additional testing sites accessible on the west side. My other concern is, while all the healthcare systems have pitched in and been willing to see patients who are uninsured to get them access to testing, there still may be a perceived barrier. And so for those who don't have an established relationship with a primary care provider or who don't have insurance, there may be some reluctance to even engage in an effort to get tested. So those are really significant concerns that we're hoping to be able to make progress with better access, particularly on the west side of the county. So, your question speaks to an underlying concern that we are trying to rectify.
Can I ask one follow-up about that before moving on to another topic?
Sure.
Dr. Fox, do you have any data in terms of, what percentage of tests that have been conducted have been done, on the northeast side of the county, for example, compared to the west side of South Bend?
I don't have that data readily available, no. I'm sorry. Yeah, it's not available.
And I had a question about the curve that we're seeing. In terms of sort of the gentler curve and maybe slight, I don't want to say flattening the curve, but a slower rate of increase of cases here in St. Joe County, especially it seems over the last couple of days here. How can you be confident that that actually reflects a slowing rate of infections as opposed to potentially lagging in test results that we're getting back?
Yeah, that's also a great question. And as I said, a week ago, I really felt like we were living a week in the past. And over the last week, we've seen a lot more of the final tests from a week ago come in, and increasingly all the results are within a day or two. So I do feel like we're seeing better real-time data. A greater proportion of the newer tests are back already than what we were seeing a week ago. So a greater proportion of all tests have been resulted now. The other is we've also seen this week an uptick in the testing activity. There have been some drop-off, I would say, last week where we were testing, somewhere between, on a weekend day, maybe it was only 30 to 50 people on a day. And here this week we've been testing well over 150 people a day across all our sites. So I think both our number of tests has increased and our turnaround time has decreased. And so I think your verbiage was right. We haven't really flattened the curve, but we certainly have decreased the steepness at which it was increasing. But I do feel encouraged that we're much closer to real-time data, and with the increased test results, still to see that drop-off in the rate of increase is very encouraging. But still important to maintain the attention to physical distance and staying home and all the mitigation strategies that have helped us get to this point. We need to keep the pressure on in those areas.
Okay, let's move to Lindsay Stone from WNDU. Lindsay, if you could unmute your microphone.
All right, does that sound better?
Yes.
Great. This question is for Dr. Fox. Two parts, and you might have touched on this already, but the audio is a little difficult. Are you able to say how the person was infected that died from COVID-19, and also how old that person was?
We're not releasing the age of the individual, just that she was an elderly female. And, off the top of my head, I don't recall her source of infection. My recollection is that she had a contact with a known case, but I honestly can't swear to that sitting here right now.
Thank you.
And now we'll move to Max Lewis from WSBT.
All right. Can you hear me?
Yes.
I think this is probably going to be to Dr. Fox as well. But I wanted to know, so on that graph you showed as far as testing and the amount of days that it started, that it came for the test to come back, the test results, what has changed in the past week that has, I guess, made for a shorter turnaround time on those results?
Yeah, that's a great question. So I think it was about 2 weeks ago that the LabCorp site in South Bend began processing tests, but they were not able to prioritize tests that were originating in South Bend. They were helping work through the national backlog, and it was just about a week ago that they got an additional machine for processing tests, and again, in working with our health system partners and with LabCorp, they have committed to dedicating that additional machine to processing local results. And so, as best I can tell, that additional equipment and that commitment to prioritizing local tests with at least that one machine is likely what's responsible for this improved turnaround time. And I think a little pressure from Jackie Wilorski. So Representative Wilorski has been very helpful in a variety of ways in our response to COVID-19, but I understand that she had some conversations with LabCorp leadership, and so that's been helpful.
And Max, I apologize, I had to mute you because there was some background noise, but do you have any follow-up questions? You'll have to unmute yourself, Max.
Sorry, I didn't realize I muted myself again. There's been a lot of talk about these antibody tests, and I wanted to know when do we expect here in St. Joe County to get some, if any, in the next few weeks, and also when should we expect to have more access to universal testing for more than just healthcare workers or people who have symptoms to be tested?
Yeah, so certainly access to testing has improved even in the last day or two. So while there's been a focus on high-risk individuals by virtue of exposure or health risk factors or being a frontline healthcare worker, we have agreed really across the health systems to broaden access to testing. We have more reliable access to the swabs and testing media, and with improved turnaround time, so that now really anyone who's symptomatic, with a plausible story, basically, we're trying to ensure that they have access to testing. So that will probably won't quite reach universal testing as you use the term, but certainly will increase access to testing. And with respect to the antibody testing, my understanding is that Beacon Health System, through their, by virtue of being part of the Mayo Clinic network, now has, or in the next day or two, will have access to antibody testing through the Mayo Clinic lab, and St. Joseph Health System has reported that they expect to have access to it in the next week. So both of those hospital systems will have access to the antibody testing.
Okay, last call for questions. If there was anyone we missed or anyone who had a follow-up question, please unmute yourself and feel free to ask it.
I guess I did just think of this, but do we have this is probably for Dr. Fox, do we have a total number of how many people have been hospitalized out of the 154 positive cases that we've had?
Yes, that's what was reflected on the slide. So the total number of individuals who have been hospitalized is 19, and the current number in the hospital, and I don't think I reported this in my comments earlier, currently in St. Joseph County, there are 11 patients in the hospital. They are not all St. Joseph County residents, and I don't know how many of the 11 are St. Joseph County residents, but there are 11 patients in St. Joseph County hospitals due to COVID-19. There are another 11 patients who are persons under investigation, so they have a test pending. 7 of the 11 patients who are currently hospitalized are in the intensive care unit. So that's current status. The total of the 154, a total of 19 people have required hospitalizations, and that number includes the 2 individuals who have died as a result of COVID-19.
Okay, thank you.
I have a follow-up question for Dr. Fox. How many test results are pending right now?
Let's see, we have, hang on one second, I can give you a better sense that. It looks like it's about 200 are pending, somewhere between 150 and probably 225 across the 3 health systems are certainly the major contributors to the testing volume. There are a few other providers in the community that are doing a much smaller number of tests. I don't have good data from those providers at this point.
It appears 19 hospitalizations out of 154 patients is about a 12% hospitalization rate, which I think is actually substantially more than some of the early projections of hospitalization rates. What can you say about that percentage compared with, I guess, the relatively low number of infections we've had in St. Joseph County? I mean, do you feel like we've dodged a bullet there in terms of the low number of infections overall when we're seeing a 12% hospitalization rate?
Yeah, that's a great question, because a lot of the data nationally, at least initially, was suggesting a lot of the data that we were using for modeling early on was based on the experience in China and other places that suggested the overall hospitalization rate would likely be in the 5 to 7% range. So we are certainly higher than that number, and yet, interestingly, we have been somewhat fortunate, I think, in the county that such a significant proportion of our infections have been in a younger population. So there is a little disconnect there, because of our population age 60 and over, that's where we've seen the hospitalization burden, which is higher than what the models might have suggested. I don't have a ready answer to what that reflects. I don't have comprehensive data about their underlying medical problems and things that led to that, but it is something that we're tracking and trying to get a better understanding of.
Thank you.
Last call for questions. Okay, thank you, everyone.
What a great format.